We're joined by Jeff Rosenberg, Dr. Jeff Rosenberg, physician of sports medicine and family practice at Summit Medical Group. Good to see you, doctor.
Thank you for having me.
Let's talk concussions.
Okay.
You know, we were talking right before we got on the air that one of our boys is dealing with that right now, is concussion protocol. Our daughter plays soccer. One of the girls in our team, concussion protocol. What's a concussion? What's the protocol, and why does it matter?
So a concussion itself is injury to the brain and to the skull, although you can have them from just a collision where you don't have an actual hit to the head, like a whiplash injury from a car. But it's an injury to the brain that affects the way the brain functions and affects the blood flow into the brain, which are one of the reasons why recovery is so hard. But anybody who's had kind of a collision or a head injury and then has a group of symptoms, which usually include headaches, but also can have physical symptoms like nausea or dizziness, being really tired and wanting to sleep all the time, having problems in school as far as concentration or focus or memory, and there's also a lot of psychological impact, including some depression or anxiety that often will kick in with folks who have concussions.
How many kids are we talking about?
We think about 50,000 concussions a year occur in kids under the age of 20 from sports and play. Nationwide, it's more about 3 million altogether when you count adults as well with work injuries and car accidents.
Does everyone get treated in some emergency room or some medical facility?
Hopefully not. Most people have simple concussions where they don't feel great, but they're not in a severe neurological status, can usually stay home. Going to emergency room usually buys you a CAT scan, which you may or may not really need, but is useful if there is worsening symptoms. So if you're kind of feeling pretty well, but within a few hours you get really, really sleepy to the point where you can't wake up, or you're really confused or don't remember things, or if there's persistent vomiting, those would all be reasons where a visit to the emergency room would be very useful.
So what's the protocol? Because I know our son had to go through a whole bunch of tests over a period of time. He's in the middle of us, we're speaking.
Yes. The protocol that most athletes deal with is once they're cleared by a physician and they're all better from their concussion, then they start this process where you start to return to exercise 3 or 4 days in a row. Every day is a little bit more intense as far as heart rate and getting the blood pressure up into the brain to make sure the symptoms still are resolved and
Why
that you still feel well.
is it too risky to come back too soon?
Well, if you come back too soon and you get another injury while you're still recovering from your first, that's when really bad things happen. So usually 10 kids a year die in America from what's called a second impact syndrome or some...
Second impact syndrome.
Right. So that's if you have a concussion, you're not fully recovered and you get another injury. The blood vessels then into the brain kind of open up quite quickly and you have this very severe increase in blood pressure. Usually involves coma and death. So even last month, a kid on the field in... I think in Atlanta, Georgia.
Please tell me I'm talking football.
Yeah, football player. The guy died on the field, had a cardiac arrest after having an injury. So some deaths in the field are not from second impacts. They can be from the first one if it's severe enough, but that's fairly rare.
Doctor, let me ask you this. I mean, again, it's not really about our kid. It's about all of us who are trying to protect our kids as best we can. I didn't want our son to play football.
Right.
But he went to the training and went through the process.
Right.
And so we did.
Right.
Is it a mistake for those of us who are parents to allow our children to play football?
I think that's very much a family and individual decision. Certainly we know there are risks of football. There's also a lot of benefits, right? You get a good workout, you got a team.
He's made a lot of friends. He's learned how to be disciplined. He works harder. He's taking care of himself. He's a better student because of it. But
all those things are true, but you can get a concussion from a car accident, you get a concussion from riding your bike. I see people getting concussions from, trampolines and, bouncy houses and places like that you don't even think about it. So they can happen day-to-day life as well as in sports. It's always a tough discussion to have with the parents and trying to figure it out. I think the kids always push to it. I do think football's got a problem. There's a lot less kids involved in youth football than there was a generation ago. And so as those groups move up into the high schools are noticing less people who want to play.
Can we protect our kids from concussions?
We can protect them to the point. It's, again, making sure you've got a good equipment that fits and that's new and modern. Although most equipment's never been proven to prevent concussions, certainly it has been shown to prevent trauma as far as fractures and major bleeds into the brain. Mouth guards and headgear in soccer, unfortunately, has never really been proven. So we can try to bubble them up and wrap them up a little bit, but it's still unfortunately not been shown to really prevent it.
The doctors involved in this particular case I'm talking about, told our son not to stop playing video games and the whole thing with the light. I mean, what are they talking about?
Well, a lot of kids have a lot of sensitivity to bright lights, and we know, and in general from concussions, plus then you're sitting in front of a computer or sitting on your phone trying to do things. The light itself can bother your brain and give you, make you feel tired or make you feel nauseous. Video games are a lot of work for your brain, right? You're processing stuff that's coming in. You've got to do something with your hands. You have to do it really quickly. And that's like running a 100-yard sprint consistently for your legs, but it's for your brain. And so your brain's tired after it does that. And so when it doesn't feel well, that's extra energy you don't need to spend. I usually tell people to leave your brain work for school and stay off the video games for a few months. You'll survive without Fortnite.
Common misconceptions, yeah, you will. Common misconceptions about head injuries.
I think in general, again, that you have to go see the doctor right away. If you have some mild symptoms and you're not worsening, it's okay not to
But if you're vomiting in a very violent way.
If you're vomiting more than once, if you've had a seizure at the time of the injury, if you've lost consciousness, or if you're really worsening over the next 3 to 4 hours, those will all be reasons to you should definitely go to the emergency room and get checked out.
How'd you get into this field?
I just was in the right place at the right time. Just as a sports medicine doctor, as concussions got really, the neurologists weren't always treating concussions well. The old system was you didn't pass out, you didn't have amnesia, okay, you can miss a week of school or work and go, of sports and go right back into it. We've learned that's not the case. You really have to treat all these kids individually and wait till everyone's completely better before you put them back on the field. So it was just something that kind of came around and I got interested in doing it.
Before I let you out here, Doctor, the role that parents play in all this, we can't micromanage and control it.
Right.
But to just hope that the team trainer, hopefully as a doctor, they're usually not in a school situation.
Well, yeah, in the high schools we'll have them at the games, but not at practice.
Right.
Right.
To just go, hey, I'm sure everything will be okay. Not enough, is it?
Yes and no. I mean, there's nothing I can specifically do to make your son's concussion get better.
No, I'm not talking about my son.
No, or any son.
I'm talking about anyone.
Yeah. I mean, there's nothing we can do as physicians to treat your concussion other than, kind of listen to your symptoms, keep you home for a few days to let you rest, let your brain recover.
Hold on, you threw me off on the rest. When it first happened, I said, don't let the kids sleep.
Well, you can let them sleep. All right, so the old style,
because that's what I thought. Don't let them go to sleep.
The old advice was wake them up every few hours.
That's
make
what
sure
I was
they're
doing.
Okay. Yeah, that's old school. All he does is make them more tired and make you more tired the next day.
You ever notice that old school comes with people who are old?
Yeah,
so
absolutely.
my son's like, leave me alone.
Yeah, all it does is make everybody tired.
Chris, I'm trying to keep you awake.
Yeah,
it doesn't help.
Doesn't need it anymore. No, we don't recommend that anymore.
Okay, so in the few seconds we have left, best advice for parents. You don't have to go unless
you don't have to go to the emergency room right away, but you should see a physician the next day, see how they're doing, keep them out of school. I can't tell you how many times I see
out of school. How many days?
Depends on how they're feeling. A few days, usually 2 to 3 days.
You can't let them out of every test.
Well, the first few days, yeah.
Yes.
Yes.
But then you go back.
Yeah, eventually you go back once you start to feel better.
Dr. Jeffrey Rosenberg from Summit Medical Group, particularly dealing with sports medicine and family practice. I want to thank you for joining us and shedding light on an issue. Trust me, it's not just our kids. There are a lot of kids out there and a lot of parents dealing with this.
Yep,
Thank you.
Absolutely. Thanks.
Well done, doctor. Stay right there.
Yep.
Check out next time, folks. That was great.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, the New Jersey Education Association, NJIT, Holy Name Medical Center in Teaneck, New Jersey, the North Ward Center, and by New Jersey Resources. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.